It's nice to see everybody back again. I was kicking us off this morning, and so grateful for Al for that introduction. I feel like we are all more aware of our healthcare needs as individuals and as a community than we were 2 years ago. I feel like we can agree with that. What we may not be as aware as we would like, though, is what are some of the systemic issues that maybe brought our country to where we are today? And maybe more important, what are some of the opportunities we have to improve? I'm joined by an amazing two friends and people that I deeply admire and respect. And so maybe just by way of introduction, Dr. Gibbons, perhaps we'll ask you to go first. A brief introduction of kind of who you are, and then we'll get into the questions.
Sure, thank you. I'm Chris Gibbons. I'm a physician, as Zeev said, trained in surgery and preventive medicine at a little place you might have heard of, Johns Hopkins, down the road from here. I now run a digital health transformation firm. So what is that? Well, if you want to innovate a little bit or you want to do things better, you might need the other guys. But if you want breakthrough insights and next level impact, you want us. That's the bottom line. And we do that especially in underserved populations in digital health, two things that don't seem to go together. And we're delighted to be working with the AMA and Dr. Maybank.
Very nice. And with that, Dr. Maybank, please, your introduction.
Awesome. Good afternoon, everyone. Good afternoon, Zeev. It's great that you've come back together again. I've always loved this space and loved the summit and how you bring the energy of people together. Aletha Maybank, I'm a pediatrician and preventive medicine specialist as well by training, but I've worked in governmental public health, honestly, most of my career, and then transitioned to the American Medical Association about 3 years ago to be their inaugural Chief Health Equity Officer. By that work means I really work a lot on improving the health outcomes and thinking about how we can improve the health outcomes across the countries. What are the structures that need to change, the laws and the policies? How do we help support physicians to actually do that work in the context of their healthcare system? And so the American Medical Association is the largest and oldest physician organizing body in this country, really working on behalf of physicians across the country.
Amazing. Thank you so much for that. So Dr. Gibbons, we have agreed that after we say doctor the first time, we'll drop the first names. Yeah. I'm not being rude. Yeah. Chris, if I may. Talk to us about In Full Health. What is the vision? What does full health mean in your mind?
Sure. So In Full Health is an amazing program that is really championed by Dr. Maybank and the AMA. As Dr. Maybank said, she's the first senior vice president and chief health equity officer for the AMA. And she outlined in a first health equity strategic plan that was launched last year, 5 pillars of bringing equity forward in the health sector. I won't go through those 5, she can do it better than I can. But one of them is to drive equity in the health innovation space, because that's a really big area. And so where we have come together, that is the External Advisory Board, the External Equity and Innovation Advisory Board, along with 15 corporations around this country who have said, yes, we agree and we want to work with you together to form the In Full Health Collaborative to drive innovation and equity in innovation, particularly as a starting point on the funding side or on the purchaser side. As you may know, most of the people funding things don't come from underserved populations. Most of the people who run the corporations and the startups developing things don't come from underserved populations. Therefore, most of the things getting built, it's hard to believe those are the best things for underserved populations. And we think if we want to be serious about fixing this problem, we've got to change that problem, and that's the In Full Health program.
I appreciate that. So I think this ties to the strategic plan and the strategic vision around embedding racial justice and advancing health equity. Maybe take a moment and explain or define those terms. I suspect a few people might be familiar with racial justice, but not in the context of health and health equity. So perhaps you could share a little bit about kind of what are the goals and kind of what are the drivers that brought you to this?
Right, I think, what's really been elevated during this time of COVID, and it's been exposed, they've been here forever, for generations. Anybody who's done equity work and justice work is very clear about these barriers that have existed for people. The reality is that some people have opportunities, other people don't. Some people have power in terms of resources and money and others don't. They have conditions of which they live in that allows them to be healthy and others don't, right? And they're there. And so what COVID did was really exposed these realities that we experience across the country and these differences in health. And so this work is really geared towards how do we, one, acknowledge and name those differences and the root causes of them. So fundamentally, the work that I do is that I name racism as a fundamental cause of why these health inequities exist. The data shows, thank you. The data shows this, right? I'm a scientist, per se, right? I'm a doctor, I'm a scientist. We like data, and many of you like data. You use data, right? You trust your data. And our data tells us this story. And so that's what we believe and operate from. And so if the structures are set up to structure opportunity, to assign value, and also to benefit some and not benefit others, then we have a problem, and we have to be real about that. And it's pervasive really in every single system that we have. Health is just one of them. But whether it's our education system, our transportation system, all of those areas experience the context of structural racism, and they all impact health. And so that's one of the narratives that we really try to push forward too, is that health isn't just in the context of the healthcare system or within the doctor's walls or the offices, right? What creates health for all of us is well beyond that. And so that means really for most of you in here, even though your lens and your lanes may not be explicitly health, it is contributing either for the good or for the bad, potentially, of all people's health in this country.
I think that was an amazing answer. Dr. Gibbons, if we think a little bit about maybe the why, which you had both just set up for us, perhaps we can shift to the how. So what are some of the thoughts that you have in terms of, let's say, the business case, the business opportunities, kind of how do we reconcile like, our desire for outcome with some of the practical limitations we may actually experience?
Yeah, so as Dr. Maybank was alluding to, this is a real problem, and it's a tough one. Let's just face it, it's not easy. If it was easy, it would have been fixed already. And we're not the only country that's struggling with this. Europe has been acknowledged it and struggling with it longer than we have, and they've made zero progress, right? But on the other, so that leads some people to believe, well, this is impossible, especially business. It's not even good for business. I mean, it might be good for society, but it's bad for business. So one of the things that we did is put together the business case as the first step. And in fact, there's tons of information, tons of science, tons of evidence already that show not only is it not bad for business, it's actually good for business. Those businesses that prioritize diversity, those businesses that champion providing services and goods to diverse audiences, not just because they say they do, but they engage those audiences to understand them and then give them what they need. Those businesses tend to be more financially successful, have larger margins, and greater impact on their communities. And so that's how we show it's not as impossible as it may look or seem, and that's a starting point.
So building on something I think you said, I think I saw in my flyer 14, but now I heard 15 corporations and organizations. So Dr. Maybank, to you, when we think about partnerships and coalitions and systems, that must be challenging sometimes. How do you get 15 people around the table in the first place, but then kind of coordinate with them to make sure that they're driving towards the same goal? Kind of what have you found, and as we think of the audience, what advice do you have for them as they're trying to maybe replicate coalition success or join a coalition like yours?
Absolutely. I mean, I think, during this time, and especially the public murder of George Floyd, post that, the exposure again of equities, there's been a lot of commitments made, a lot of maybe some good intention, and hopefully there's impact, some lip service as well to it, to be quite honest, but they're the commitments that are made. And so how do we build and capitalize on those commitments made? Because what I find is that with the good intention, which in the equity space really isn't enough, it's about the impact, and that's what we have to focus on. But with that good intention, how do you harness that? And folks want to have a sense of what are the actions that they need to do to kind of put forward this kind of the sense around equitable innovation. How do they, center the voices, the people, the ideas of those who have been historically most colonized, marginalized, minoritized within this country, that have been left out and excluded? What are those processes to help do that? What is an organizational assessment that one can do as a baseline? Again, using your own data to figure out who are you giving your money to, who's at the table, who's not at the table. What are the metrics that you need to put in place to hold yourselves accountable? You cannot have equity without accountability, bottom line. And then who are you also thinking about as you're building your models for like around assets and wealth building opportunities, not just for yourself, but for the communities that you also are working with. right? The whole context, I had a friend the other day say to me, health is wealth. And I said, no, wealth is health.
Yeah.
Because the reality is that those, and we all know this in this room, the more wealth you have, the much easier it is to take care of your health. And the reality is that the majority of Americans are excluded from the ability to be able to take care of their health, but also the ability to be able to build wealth. And so how do we share that opportunity? How do we work to support being in a learning community, to share the successes, the pitfalls, and how to build better together?
Maybe just a follow-up on that. So if we think of the theory of change, how would that work in practice? Kind of, can you give us an example? I think the health is wealth is a great analogy. I've heard the term wealthy, like wealthy with an H in there, wealthy.
Yeah.
I've heard it, I don't know. Wealthy, yeah, okay, great. So what's an example in practice? Kind of how does this kind of play out in terms of theory of change?
So, how much time you got? Well, there are a number of levels, right? And that's what makes this complicated. I assume you're asking at the doctor level, at the provider level. That's one way.
Level, yeah.
At the community level. So one of the things that is beginning to happen at the practice level is, for a long time, doctors didn't even ask about that, didn't even think about that, they just sort of ignored it. Tell me about your hemoglobin A1C, tell me about your glucose, tell me about those kinds of things, and assumed if I could fix those things, then that's all that needed to do. Well, that didn't work for every population, and so now as our payment systems are changing to not just pay me because you did it, pay me because they're getting better, and we're finding some populations are not getting better despite what we say. We're beginning to look at other places, and you know what? Oh, you mean you actually live on the street? Oh, you're not able to eat well. Oh, so the health at the practice level, one thing that's happening that is good is that doctors are beginning to ask about these other determinants of health beyond your biology, beyond your genetics, that science has shown, quite honestly, the medical system impacts about 15% of your health. These other social determinants of health probably make up about 85% of your health.
Huge.
Yeah, 85%. So
yeah, and this is also like a design conversation, right? So I'm going to bring up, I used to work for New York City Department of Health. I was deputy commissioner, and used to oversee kind of the communities that had the worst health outcomes in the city. And I'm going to bring up an innovation from 1896, bike lanes, right? Bike paths. Mm-hmm. And about 10 years ago, across the country, there was more conversation about, cities needed to have bike lanes, and they needed to be accessible so folks could go ride through them. Right? But the reality is that a lot of folks, especially within New York City, who were leading these positions were really from white middle-class communities. They were putting forward good ideas, good intentions, but not necessarily particularly relevant for the community. So what I would hear about bike lanes those bike lanes are being racist because they know they slow down traffic, and we have high rates of asthma. So why are they doing this to our community? And I'm not saying Black and brown communities don't ride their bikes or ride bikes. But that context of being proximate and next to the community allowed you to understand and allowed us to understand that something else needed to happen, right? You have impact in terms of your design, your solution. Apparently, sometimes there's going to be inherent bias if people are excluded from the conversation of designing. That impacts trust. It potentially exacerbates inequities, and it saps society of its full human potential.
Absolutely.
It's an amazing example. And I think you spoke to intention. I mean, we can assume the roots were intended to be positive, but the outcome didn't maybe arrive at its full potential because it didn't have the right people at the table designing and implementing. We have a few minutes left, so maybe Dr. Gibbons, as we kind of begin a little bit of the wind down, looking at kind of in full health and thinking about short-term goals, long-term goals, connecting with health equity, what are your hopes? What would you like to see happen?
Wow. Well, I think one thing is as we grow over time, it's not just 15 organizations, it's every organization in America is committed to these things because this is what's right? That's sort of one thing. And then it begins to change the needle. I mean, if we continue, you all know the definition of insanity, doing the same thing and expecting different results. So if the funding game is the way it is, which leads to the production game the way it is, we can't be surprised at the outcome game the way it is. So if we want to change that, we got to change this. So I would hope that over time we'd see those funding numbers begin to shift. This is not about quotas. This is not about anything other than doing the right thing to make a difference to improve health for us all.
That's a great answer. So to you as well, we talked about racial justice and injustice. How does in-full health connect back to the AMA's goals? How do you see that kind of bridge being built in the future?
Sure. I mean, the reality of AMA in the historical context, and some people may not know this or know this, but and some people call the AMA the poster child of racial injustice, truthfully, because for over 100 years it excluded Black physicians. And so, there is some accounting and some reckoning that we have to do. We did issue an apology in the early 2000s to those physicians. However, there are other harms that have been done on the part of the organization, but AMA is not unique to that. Lots of old standing institutions in this country have a lot of reckoning to do. And so this really is acknowledging that we as an institution that does have power in terms of money and power in terms of advocacy, have a responsibility to hear and to engage with those who have experienced and have been recipients, I guess, of that harm. Right? And what do we need to do differently and what do we need to do better, I think is a lot of the goal that we have to do moving forward. And I just want to, acknowledge the champion context. And as you all step out into this space, and to me what championship means during this time is really having those conversations, that may not feel safe or may feel uncomfortable. And I get it. It's not easy to talk about injustice and all this context because it's just not what we know, right? And there are all these things and barriers. But I just say, do your best and try to step into it. It's really critical and really important at this time to have that courage. That to me is being a champion.
That's really well stated. Wow. So maybe with our last minute or two, Aletha, to you, if you had a request of the audience, if there is an action they could take or a step, something they could do within their organizations, their community, or as individuals, what might that be?
Sure. Well, I just said one. But on your table, there's the card, in-full health, and to learn more about the community of in-full health and how to engage. There's a QR code to be engaged with us, so that you can learn those action steps of actually embodying what equity looks like. So it's not, and it feels like, so that it's not just this kind of lofty conversation. So my ask is just to engage with us. And we can follow up with you, and we'd love to have you a part of the community.
Absolutely.
Great answer. Dr. Gibbons, same?
Yeah, no, I would totally agree. There's a saying that says everything is impossible until the first person does it. So which one of us is going to be the first organization, the first person in your organization to come together with the AMA and make this problem history?
That's amazing. So I'm just going to summarize a couple thoughts on my mind. One of the things that really struck me was your approach towards coalition building, and you began with the why. Why was it important? What was the purpose? But I think that it's almost in a good way surprising to see the AMA be this bold and take this initiative. I love that the three of us get to get up on stage and talk about something that I think is almost bigger than health, if we're being honest, and you alluded to it. It's talking about systems in this country. It's talking about opportunities. It's talking about partnerships. We could substitute health for transportation, housing, Wall Street, et cetera, and all of these things come together. And I think to me, and I think you alluded to it, it's incumbent upon us to be willing to open our minds, open our hearts, take the first step and say, does it need to be this way and can it be better? And if the answer is yes, who can I do that together with? And so Al Roker said an amazing tone about heroes. These are two of my heroes. I hope at the end of this session they become two of your heroes as well. I'm so grateful for the champions in our lives like yourselves that have really, I think, set the tone for what our future can look like as we think about our goals that we want as individuals and corporations and as citizens. I aspire to be a fraction of a small change agent in the vision that you've laid out for us. And so join me in congratulating this amazing panel. They were just unbelievably incredible. There's a follow-up session during the breakout, so if you're interested in learning more and want to engage further, we can certainly field any questions. Did you want to say? Oh.
No, I'm good.
I thought you were ending.
Well, thank you. I mean, see, like,
absolutely.
you're also, like, I don't know if I'm allowed to say this, but, I really echo what I said in the beginning of this ability to be able to create space for people to connect in ways that are comfortable. It's crucial, and I think at this point in time, and I think what a better summit to be able to come to, after 2 years of being by ourselves often. But just again, really thank you for bringing us together in this way with such compassion.
Thank you
and
guys. Thank you.
thoughtfulness.
Thank you guys.
Thank you.